Thank you, Jeff. Good afternoon. Let's begin with an overview of the data. Yesterday, CDC reported 132,384 new cases of COVID-19. Our 7-day average is about 113,000 cases per day, and this represents an increase of nearly 24% from the prior 7-day average. The 7-day average of hospital admissions is at about 9,700 per day, an increase of about 31% from the prior 7-day period. And the 7-day average of daily deaths has also increased to 452 per day, an increase of 22% from the prior 7-day period. We continue to see cases, hospitalizations, and deaths increase across the country. And now over 90% of counties in the United States are experiencing substantial or high transmission. As we have been saying, by far, those at highest risk remain people who have not yet been vaccinated. This week, we are taking 2 important steps in encouraging and improving vaccine protection for Americans. First, for pregnant people who are at higher risk of severe illness from COVID-19, we are strengthening our guidance and recommending that all pregnant people or people thinking about becoming pregnant get vaccinated. We now have new data that reaffirm the safety of our vaccines for people who are pregnant, including those early in pregnancy and around the time of conception. These data build on previous evidence from 3 safety monitoring systems that did not find any safety concerns for pregnant people who were vaccinated late in pregnancy or for their babies. Now, these new data found no increase in the risk for miscarriage among people who received an mRNA COVID-19 vaccine before 20 weeks of pregnancy. Clinicians have seen the number of pregnant people infected with COVID-19 rise in the past several weeks. The increased circulation of the highly contagious Delta variant, the general low vaccine uptake among pregnant people, and the increased risk of severe illness and pregnancy complications related to COVID-19 infection among pregnant people make vaccination for this population more urgent than ever. Second, I want to take a moment to discuss what we are doing to help increase protection against COVID-19 for certain individuals who are moderately and severely immune compromised. As we've been saying for weeks, emerging data show that certain people who are immune compromised, such as people who have had organ transplant and some cancer patients, may not have had an adequate immune response to just 2 doses of the COVID vaccine. To be clear, this is a very small population. We estimate it to be less than 3% of adults. We've been working to identify how best to provide increased protection to these vulnerable people who are disproportionately impacted by severe outcomes due to COVID-19. FDA is working with Pfizer and Moderna to allow boosters for these vulnerable people. An additional dose could help increase protection for these individuals, which is especially important as the Delta variant spreads. Following FDA's decision, CDC will hold a meeting of its Advisory Committee on Immunization Practices tomorrow to discuss this issue and offer their expert insights and recommendations. We look forward to that discussion and to helping support this vulnerable population. At this time, only certain immune-compromised individuals may need an additional dose. Emerging data, including from a significant study published in the New England Journal of Medicine yesterday, show that there's an enhanced antibody response after an additional dose of an mRNA COVID-19 vaccine in some immunocompromised people. This action is about ensuring our most vulnerable, who may need an additional dose to enhance their biological responses to the vaccines, are better protected against COVID-19. The science and resulting data in this pandemic are moving extremely rapidly. The US government, in turn, is moving swiftly to analyze the science and make the recommendations most appropriate to protect Americans. We know our vaccines are safe and effective, and if you have not gotten a vaccine yet, please do so today.